This presentation on Fragile X will provide some basic information on the disorder and the genetic mechanisms and the family history pattern that one will encounter when dealing with Fragile X families. Fragile X syndrome occurs in approximately 1 in 4,000 males, and although it is an X-linked disorder, it can show up clinically in about 1 in 8,000 females. It is one of the most commonly inherited causes of intellectual disability. As an X-linked genetic disorder, it occurs more frequently in males. The phenotypic features of Fragile X syndrome includes a range of developmental problems, including learning disabilities and cognitive impairment, autism spectrum disorder, speech and language delay, neurological dysfunctions such as seizures and abnormal sleep pattern, and some characteristic physical appearance such as long narrow face, large ears, prominent jaw and forehead, unusually flexible fingers, flat feet, and in males, enlarged testicles after puberty. Fragile X results from changes in the Fragile X messenger ribonucleoprotein 1 gene, which is mapped to the long arm of the X chromosome at band Q28. So this particular gene, that is the gene coding for FMR1, has what is known as trinucleotide repeats, and in this case it is a CGG trinucleotide that is repeated. Different people have different numbers of these CGG repeats. Most have less than 45 repeats. People with Fragile X nearly always have more than 200 repeats, which is many more than normal. So having more than 200 repeats causes the FMR1 gene to turn off so that it cannot make the FMRP, the protein made by the FMR1 gene. When a person's FMR1 gene has more than 200 repeats so that it cannot make the protein, the person has Fragile X syndrome. So when you encounter a family with Fragile X, the initial pedigree may be very simple. It may just show something like the one that is shown here, where there is a couple with 3 children and one of their sons has Fragile X. However, there is the potential that when you take an extended pedigree, you will see a number of males who are affected with Fragile X in the family. And all these males you will see are related through females. So the females are the carriers, and the children of the carrier females, the male children of the carrier females, are the ones that predominantly show the syndrome. So as I mentioned earlier, the number of CGG repeats varies in individuals. So a normal individual will carry anywhere between 5 to 44 repeats, and these individuals do not have Fragile X syndrome and do not have a higher chance of having Fragile X, of passing Fragile X or having children with Fragile X syndrome. When the number of repeats gets to between 45 and 54 repeats, they are called, that range is the intermediate range. Individuals with the intermediate range of repeats do not have Fragile X and are also not at risk for having children with Fragile X. However, they may have a slightly higher chance of having some symptoms related to what is known as other Fragile X associated disorders and may pass the slightly higher chance of having these disorders to their children. We will talk about the so-called other Fragile X associated disorders later in the presentation. When the number of repeats is between 55 to 200, that is what is called the premutation range. So this is the premutation in the FMR1 gene. Individuals who carry the premutation do not have Fragile X syndrome, but they might have or may later develop the other Fragile X associated disorders. They can also have children with the premutation or full mutation. The chances of having a child with the premutation or a full mutation are different for women with the premutation than they are for men with the premutation. So men with the premutation do not have a higher chance of having a child with a full mutation. However, women who have the premutation are at an increased risk of having a child with the full-blown mutation. So in the case of females with between 55 to 200 repeats, the more CGG repeats a woman with the premutation has, the more likely her child will inherit an FMR1 gene with the full mutation and therefore have the Fragile X syndrome. With each pregnancy, a woman with a premutation in one of her FMR1 gene has a 50% chance of passing on either the premutation or a full mutation to her child. It could be daughters or sons that they pass the full mutation or the premutation to, and a 50% chance of not passing on either the premutation or the full mutation. In the case of males with between 55 to 200 repeats, males will pass on their premutation to their daughters but not to their sons. And this is because the males inherit the Y chromosome from the father, whereas the female children inherit the X chromosome. A man with a premutation will not pass on a full mutation to any of his children. Although Fragile X is an X-linked disorder and manifests mostly in males, some females can show certain phenotypes. It does not directly correspond to the development of Fragile X syndrome phenotype, but rather presents genetic risk for a particular set of cognitive, socio-emotional, and behavioral outcomes. Phenotypic signs and symptoms will be expressed differently as a result of X inactivation, other genetic factors, and environmental influences. Many females with the Fragile X syndrome meet the criteria for one or more Diagnostic and Statistical Manual of Mental Disorders 5 diagnosis, and these include generalized anxiety disorder, social anxiety disorder, math learning disability, intellectual disability, autism spectrum disorder, and attention deficit hyperactivity disorder, just to name a few. These diagnoses are useful insofar in developed countries to enable the individual to receive necessary services and accommodation. These diagnoses can also facilitate communication among mental health professionals. So in addition to the Fragile X syndrome, there are what is known as the other Fragile X associated disorders, usually in the premutation carrier population. Individuals individuals with the premutation of the FMR1 gene do not have Fragile X syndrome, but may have other Fragile X associated disorder. Some people with the premutation may have noticeable symptoms and others may not. One of the Fragile X associated disorders is the Fragile X associated primary ovarian insufficiency. Women who have a premutation in their FMR1 gene are at higher risk for primary ovarian insufficiency. Fragile X associated primary ovarian insufficiency is a cause of infertility and early menopause among adult women. Women with this condition stop having menstrual cycles and have symptoms of menopause before age 40. The other Fragile X associated disorder is the Fragile X associated tremor ataxia syndrome. The Fragile X associated tremor ataxia syndrome is a disorder of the nervous system that can cause tremors and problems with walking, balance, also called ataxia, memory, and mood disorders among older adults. It can be caused by premutation in the FMR1 gene. So when taking a family history of an individual or a patient with Fragile X syndrome, fertility and early menopause, which is the Fragile X associated primary ovarian insufficiency, and the Fragile X associated tremor ataxia syndrome should also be taken into consideration. So one has to ask whether there are individuals, females in the family, that have experienced early menopause, or and also other individuals who have tremor, older age onset or advanced age associated tremor and ataxia, features of tremor and ataxia. So in a family as shown here, some of the males and females, the female carriers may show the ovarian insufficiency or even the tremor at later age, and the males who are carrying the premutation may show advanced age ataxia and tremor. So this is the kind of information that, if obtained while obtaining the family history, can be informative in determining if a particular patient is a candidate for being tested for the Fragile X mutation, for genetic analysis for the Fragile X mutation. So what are the indications for Fragile X testing? Any male or female with intellectual disabilities, developmental delay, speech and language delay, autism, or learning disabilities of unknown cause. Any female with infertility, elevated follicle stimulating hormone levels, premature ovarian failure, primary ovarian insufficiency, or irregular menses. Any adult over 50 years with features of ataxia, including intention tremors, ataxia, memory loss, cognitive decline, or personality change, especially in combination with the positive family history of Fragile X. Any preconception or pregnant woman who expresses interest in or requests Fragile X carrier testing would also be candidates for indication for Fragile X testing. So what are the treatments available for Fragile X syndrome? The non-pharmacological therapy for Fragile X syndrome include physical therapy, occupational therapy. Speech language therapies are critical in addressing gross and fine motor and speech language delays. and also applied behavior analysis for social communication deficits in patients. There are some pharmacological therapy that's available essentially to deal with attention deficit hyperactivity disorder symptoms, anxiety symptoms, aggressive behavior, sleep problems, and seizures. So to recap, Fragile X syndrome is an X-linked disorder. Males are affected, some females can be affected based on, and that depends on the X inactivation. Pre-mutation female carriers, those are the females who have between 55 to 200 repeats of CGG, are at risk of having children with Fragile X. Pre-mutation carriers and intermediate carriers, that is individuals also with 45 to 54 repeats of CGG, can have other Fragile X associated disorders. So the other Fragile X associated disorders are the Fragile X associated primary ovarian insufficiency and Fragile X associated tremor ataxia syndrome. Any male or female with intellectual disabilities, developmental delay, speech and language delay, autism, or learning disabilities of unknown cause may be carriers of the Fragile X, maybe the Fragile X syndrome carrier patients. Any female with infertility, elevated FSH levels, premature ovarian failure, primary ovarian insufficiency, or irregular menses could also be carriers of the expanded repeats, increased number of repeats. Any adult over 50 years of age with features of ataxia, including intention tremor, ataxia, memory loss, cognitive decline, or personality change, especially in combination with a positive family history of Fragile X, may be carriers or may have the premutation for Fragile X. And these features should be taken into consideration when obtaining the family history. Please email your questions, comments, and suggestions to mtgenetics@gmail.com. Thank you.